The brain is the most critical organ in our body, and yet we rarely monitor the brain to be sure it's getting what it needs. In cases where patients are critically ill, current monitoring methods are inaccurate, invasive, involve drilling into the skull, or unavailable in the clinical situation. What clinicians desperately need is the ability to measure cerebral perfusion non-invasively in real time at the bedside on every patient.
I'm Dr. Rob Cooper. I'm Chief Scientific Officer at CoMind. I've spent nearly 20 years working in non-invasive brain monitoring technologies. Scientists and researchers have been using light to measure the brain since the late 1970s. But the technologies developed in that time have all suffered from a range of really fundamental problems, from being vulnerable to interference from lights in the room, to being unable to distinguish the biological processes in the scalp from those in the brain.
A solution to this problem would affect and benefit millions of patients.
CoMind has developed the most advanced optical neuromonitoring device ever made. CoMind's technology uses a low-power laser and an interferometric detector. Light from the low-power laser is split into two beams. The first beam is sent to the patient's sensor, where a safe level of light is transmitted into the tissues of the head. Some of that light returns to the surface to be collected. This collected light is then recombined with the second beam from the laser. By recombining these two beams to create an interference pattern, we're able to provide an incredibly rich optical measurement of what is happening in the brain tissue. This technology has the potential to provide a whole range of critical physiological signals, including cerebral blood flow, cerebral autoregulation, intracranial pressure, as well as cerebral oxygenation, and ultimately the metabolic rate of brain tissue.
We've designed our technology to be incredibly easy to use. It's a small self-adhesive sensor that's applied to the forehead in less than 10 seconds.
Our approach has the potential to provide clinicians with immediate access to a whole range of critical neurophysiological parameters at the bedside, non-invasively and in real time.
This technology is remarkable in its ability to overcome many of the hurdles that have caused past efforts to fail.
I'm James Dacomb. I'm the founder and CEO of CoMind. CoMind's mission is to redefine the way the brain is measured and treated to optimize patient outcomes across the care continuum. I wanted to build a suite of tools so that clinicians could have a new window into the brain. This ultimately will lead to more actionable insights to improve the way that patients are treated all across the care continuum. The progress to date has only been possible because of the world-class team that we've been able to assemble.
We have world-leading optical engineers,
Physicists, data scientists, and advisors that make up the CoMind team.
The non-invasive nature of the measurements makes this technology available across the care continuum, from the emergency room to the operating room to the ICU and post-op care.
This technology is truly innovative and represents a major leap forward in non-invasive brain monitoring.
This will make a substantial difference in how we treat millions of patients every year.
In the future with CoMind's products, we want to ensure that patients are treated more effectively.
The ability to measure cerebral perfusion at the bedside will be a step change in critical care medicine.
We're building a world where patients can live longer, healthier, and happier lives.